Welcome everybody to our webinar today. The focus of our webinar is the added value of partnerships in research, effectively engaging communities and patients. We are about to have Dr. Melman do a brief introduction into our center, which is the Georgetown-Howard University Clinical Center for Translational Science. And then we will go into the content of our today's presentation.
Hi, this is Dr. Tom Melman. I'm one of the two PIs of the Georgetown-Howard Universities Center for Clinical and Translational Science, and I'm the director at the Howard University site. And I'm very excited and pleased to introduce today's webinar entitled The Added Value of Partnerships and Research, Effectively Engaging Communities and Patients. And I'll be introducing the presentation and followed by my capable colleagues, Florencia Gonzalez, Cindy Richardson, and Yejide Obisa-san, who are the architects of this informative presentation, and members of our team who lead us in our pilot study process and community engagement and patient engagement programs. Can I have the next slide, please? Next slide, please. There we go. So, I'm representing GHUCCTS, which is spelled GHUCCTS, and pronouncing the acronym, the C's are silent. However, you'll notice that unlike many acronym program names these days, our name is taken from the first letter of every major word in our title, the Georgetown-Howard University Center for Clinical and Translational Science. We are funded by the NIH Clinical and Translational Science program. We are one of 60-some centers around the United States that are part of a interactive network and hubs for promoting clinical translational science at their institutions. And the overall mission of the CTSA program is to stimulate innovative interdisciplinary research and encourage collaboration among different organizations involved with healthcare. Our particular hub is comprised of 5 institutions. It is co-led by Georgetown University and Howard University and has important participation by the MedStar Health Research Institute, the Washington VA, and Oak Ridge National Laboratories. The next slide, please. So with regard to GHUCCTS, our mission as we defined it, which is very much in concert with the mission of the National CTSA program sponsored by NCATS, or the National Center for Advancing Translational Science, is to promote and support interdisciplinary collaborative research that works to more effectively translate new scientific discoveries into improvements in healthcare, particularly for underserved populations in our communities. And in thinking about the underserved populations in the greater DC area, we focus on older adults, people with disabilities, people from diverse racial, ethnic, and cultural backgrounds, and veterans. And we do this with an approach that encourages collaboration and, when warranted, team science. Next slide, please. So one of the key features of our program is the provision of a pilot studies program. And for pilot studies, we usually have an announcement of a request for applications at the beginning of our fiscal year, which usually is in late March or early April that this comes out. And this year will be a little complicated by the fact that we're, all goes well, switching to a new 5-year award. But we have been offering up to $40,000 for a period of 8 to 12 months funding opportunities for pilot studies. And we think this is an important part of our program and that it catalyzes the type of activity that we wish to promote. Investigators from all of our participating institutions are eligible, and we like it when there's collaboration between our institutions. We also prioritize in making funding decisions that there's an interdisciplinary approach, including, when appropriate and relevant, and it often is, patient and community engagement, and that, of course, will be the emphasis of what you're going to be hearing. We have a new emphasis on environmental determinants of health with partnerships involving both Oak Ridge and the DC Department of Health, so we're particularly interested in projects that focus on such issues. We also prioritize studies that we feel will have impact on underserved populations, and when they're completed and generate pilot data, potential for external funding. The next slide, please. This is a list of the pilot studies that we funded during the current fiscal year, and I won't read them to you, but you can see that they're represented by principal investigators from Georgetown-Howard and MHRI. We often fund investigators from the VA, it just wasn't in this particular round. And you can see that the focus of the various projects includes population health, incorporating geospatial analysis, health service-related projects that utilize electronic health record data to predict opioid overuse, as well as changes in glycemic control, and new technologies such as machine learning and biomolecular approaches to problems. So we really try to have a diverse portfolio. Next slide, please. So regarding this particular webinar, our goal is to describe effective strategies for engaging communities and patients in order to help investigators identify levels of community or patient engagement that are most appropriate for their research. And in doing so, I want to remind people, as is illustrated on the left part of this slide, that there are different phases to project development, some of which should precede the actual submission of an application. And there are times when it is appropriate and helpful to include community and or patient input at all of these different phases. And by doing so, we believe that you will improve the quality of your research, as well as the competitiveness of grants. This is not just a local value of involving community members and patient input, but it's becoming an increasing priority of research activity in the United States and elsewhere. And that you will be able to maximize the likelihood that your research will have impact on the health of communities by including and considering input from community members at the outset. So thank you very much, and I now look forward to the rest of the webinar, which will feature, as I said before, Florencia Gonzalez, Finney Richardson, and Yejide Obisasan.
Hello, this is Yejide Obisasan chiming in here. Just want to give you all a quick overview of our presentation for today. First off, thank you again for participating. We really appreciate you taking the time to discuss this very important topic. For our presentation today, we're going to be going over, to start with, the added value of PE and CE in research, the continuum of engagement, barriers in PE and CE in research, engaging communities, best practices, engaging patients' best practices, GHUCCTS services for PE and CE, and reflecting engagement in grant proposals. Before I hand it off to my colleague Florencia, this is just a reminder, the presentation should take about 50 minutes. After that, we will go into a Q&A session. You are free to hang around for the Q&A or step out if you need to. And we will also be providing the slides after the presentation, as well as a quick tip sheet that you can orient yourself to be able to come back to some of the things we talked about today. So, Florencia, I'm going to hand it off to you.
Can you hear me? Okay, great. So, what is patient and community engagement? Patient engagement is the meaningful involvement of patients or caregivers throughout the research process. The key word is meaningful, and we will discuss what that looks like throughout this presentation. Likewise, community-engaged research involves meaningful collaboration. And we do ask that if you can please mute yourself. Yes, thank you. Okay. Community engagement and patient engagement are a process or an approach for conducting research. It's not a methodology like a randomized clinical trial or an observational study. In fact, it works pretty well with just about any study method. It requires partnership development, cooperation and negotiation, a commitment to address issues collaboratively. It exists on a continuum with a variation in strengths and intensity. What approach you use or what intensity of engagement you apply will depend on the research objective, on the project, participants, on community history, for instance. It will determine what is the most appropriate approach for your study. We will talk later about how we can be of support if you are looking to apply these approaches in your specific research project. So, if you look at the literature for studies that have incorporated patient and community engaged approaches in their research, you may find that the terms can be used interchangeably, particularly as so many of the principles and recommended best practices are interchangeable, such as committing to co-learning or willingness to listen and maintain an openness to stakeholder input, or striving for a mutually beneficial partnership. However, there are some clear distinctions. Typically, a patient's motivation to partner in research is based on their lived experience. It's personal. The same can be said for the caregiver or advocate of someone with a given disease. When partnering with communities, you'll find that you may engage with a community leader, the head of a community organization, or a church minister, or an average citizen who represents a collective voice or has a common concern, such as the high rates of obesity in a given community. Regardless of where your research falls in the translational research continuum, we hope today's webinar will help you reflect on ways you can incorporate either a patient or a community engagement approach. So, why is it valuable to integrate the patient or community voice in your research? Because clinical research is typically conducted in a controlled and sanitized setting. And once the research data is actually translated into the real world and used by practitioners, let's say in private practice or in small community hospitals, it may not always be applied the same way that it was in the clinical study. And of course, the populations may not necessarily reflect the same individuals that were in the clinical trials. So the fact that the populations in research are often very different from the populations that ultimately receive the discovery in terms of treatment is one reason why patient and community engagement is very important. Their insight can enhance the capacity for new innovative treatments and discoveries to be taken and adopted in community settings, because community practitioners and real-world patients have had an opportunity to help shape the nature of those discoveries. So, health practitioners and researchers typically spend most of their time studying issues at the level of healthcare, or biology, or individual behaviors. most of the social determinants of health, such as those listed in this slide, are typically given minimal acknowledgement, if at all, in health research. For instance, unless the physical environment of a city or a town or a neighborhood is the focus of the research, the built environment is rarely considered as a potential explanatory factor. Patients, caregivers, and communities, therefore, can bring insight on how their race and ethnicity, their cultural, their beliefs, their economic conditions, the environment around them can impact their health. When these stakeholders are engaged in the research development process from the beginning to end, we can begin to see an expansion of thinking among researchers and among the research team members about questions such as the very definition of health and disease and the root causes of ill health through a more comprehensive lens. If I can ask you one more time to please mute yourselves. There is a little bit of background noise. Thank you. Because community and culture also shape identity and have a powerful influence over thought and action in all of us, these factors are also fundamental pillars on which health is constructed. As such, cultural and community have to be given a place in biomedical research and not solely relegated to the areas of social or behavioral sciences. Community and patient partners who can serve as cultural brokers can help build those bridges to diverse cultural, racial, and ethnic groups, as cultural brokers is a go-between. They link or mediate groups or persons of different cultural backgrounds for the purposes of reducing conflict or producing change. Cultural brokers can also help with efforts to expand research to typically underrepresented individuals and can support in the development of cultural and linguistically appropriate materials in English and in other languages. They can help assess for appropriate literacy levels of the consent forms, for instance. Likewise, they can help ensure that the meaning of concepts in study assessments are clearly understood, whether in English or other languages, especially as translation is not enough to ensure validity of measurement tools in other languages. For example, an investigator we worked with did some cognitive interviewing among Hispanic women from different parts of Latin America to assess for clarity in the consent form in surveys. And they identified at least 5 different words for children: chamaco, cipote, and a host of other words, tepescuincle, and the list goes on. So you can see how it's really important to include the voice of patients and community, especially a diverse group of patients or communities, into health research, because they help you understand and they help you see these potential barriers that could affect even the validity of your measurement of your tools. So this slide here demonstrates ways patients or community stakeholders can provide input from the design phase to the dissemination phase. For instance, they can provide insight on the relevance of study aims and outcomes. They may even identify study aims that the study team had not anticipated, therefore making the research more applicable to the patient's experience. During development of research of recruitment material, patients or community stakeholders can help make the flyers more appealing to a given population, and they can ensure that the language is clear and understandable. Finney will provide examples later in the presentation of feedback that investigators from our patient advisory board has provided investigators, and the modifications that these investigators have made to their recruitment material or even to their study approaches based on this feedback. In terms of retention, feedback from communities or your patient stakeholders can also be really valuable. We had a community-based organization working with an investigator, and staff of that organization help the research team account for potential loss of follow-up of study participants. Based on the organization's experience with loss to follow-up for service provision, they were able to guide the investigator to make sure that they got phone numbers from friends and relatives of that particular study participant. That way it would allow for you to not lose that, that study participant for follow-up procedures. These stakeholders can also help in developing a dissemination plan that goes beyond the peer-reviewed journals, where study findings can also be shared among patients in communities, at community events, through newsletters. I mean, they can provide great insight in that regard. Okay, so that was a mouthful. Hopefully, we've been able to demonstrate how patients and communities can be of added value to the development of your research. And more broadly, these approaches can also have critical impact on the health of our communities. Okay, so here I want to talk a little bit about the different intensity levels of engagement. Though the gold standard is to collaborate and have shared leadership between your stakeholders and you and your research team, that's not always going to be possible, and we're very realistic about that, because community engagement is what do you call that? It's not one fits all. Probably said that wrong. Not one size fits all. Thank you. So, for instance, when you go out to the community and inform them about your studies, let's say, at the health fair, that's what we call outreach. We don't really consider that engagement. We would say that that's probably the minimal intensity and interaction you would have with stakeholders. Then we get to a bit of more intense relationship, where what we call consult, where you obtain public feedback. So for instance, you might do some focus groups prior to a grant proposal, and this will inform the feasibility of your study for a given community or culture, and it can help with linguistic considerations, among other factors, and how it can help. Then we get a bit more intense in the relationship, and that's where you work directly with the stakeholder to ensure that concerns and input are directly reflected in the research process. So this could be, for example, incorporating a patient advisory board for your study, or a community advisory board, depending on the nature of the study. Then a more intense sort of collaboration can also be called community-based participatory research. That is where there is a more intense input from the stakeholders, and that's where when you saw the process before, the image of the process, that's really where community-based participatory research is in full play. So that's really what we encourage. We encourage these collaborations, and we encourage shared leadership and allowing communities to also bring in their research ideas. But again, we recognize that that's not always going to be the case. So whatever level of engagement you can bring into your study, that's great, as long as you're making an effort to really engage them in a meaningful way. So we're going to open up the mic to the audience, and we'd like to hear more about what barriers you might have encountered or anticipate encountering if you decide to include a patient or community engagement approach in your research. So please feel free to share via the phone or through audio or through chat. Anybody have any experience with any barriers that they've identified? And Yesterday will let us know if there's anyone in the chat box that okay. So feel free to include that in your chat box, and we're happy to address that at any point. If we can ask you to please mute your line, we'd really appreciate it. And one of the things is that our services that GHUCCTS offers is consultation services. And if you have identified barriers or anticipate barriers, we're happy to work with you through those barriers to help you build a partnership with your stakeholders. So in the end, we'll talk more about our resources and the ways we can be of support. This presentation isn't the end. This is only the start. We can then bring you in and help you in terms of consultation, in terms of providing resources. Okay, so I'll talk a little bit more about what the perception in the community is about researchers. So there have been some comments made by individuals in the community that have worked with researchers, and they feel that, here are a few examples. It's called helicopter research. They flew in, took our personal info, took off, we never got anything back. The academics got a grant for reduced smoking, but when we're really concerned with is gun and gang violence. So here, I think what they're trying to say is that maybe they didn't feel heard. The professor can't just walk in with the expectation of creating a partnership. It takes time to understand each other and make sure we won't be exploited. And all of these comments really lead to some of the best practices we're going to discuss and some of the tips we'll provide for you so that these perceptions are not there when you're engaging with your stakeholders. And lastly, the university implemented and evaluated a really nice project, but then the money ended in the program right along with it. Definitely an example of a project that did not account for sustainability. Though listed in the literature as community-engaged research principles, these can be applied to either community or patient engagement. We have had investigators come to us for help in identifying community partners, mainly for recruitment purposes, which is a common request. However, there needs to be a mutually beneficial give and take in the partnership, and we cannot stress this enough. This is one of the most important principles that will safeguard sustainability and a healthy, long-lasting partnership and project. So we encourage investigators or their research team members to explore prior to reaching out to potential partners in the ways they could be of support or the resources that they can offer the community partner. For example, being willing to do community presentations on expert topics, help with providing meeting space on campus. We've sometimes done that with some community organizations that needed meeting space, and we were happy to accommodate. Help with analysis of organizational data. Asking what your partner needs is always a good start. We have talked about the added value of bringing in patients and communities into the research development process. This brings an ability to share power with your stakeholder because you actually acknowledge that each has something valuable to contribute. You are essentially building an environment that allows for co-learning, where each partner agrees there is something to learn from one another. And in this process, as a researcher, you actually become part or closer to the community or your patients, and the community actually becomes part of your research team. Our PAB is a great example of that, our Patient Advisory Board. And in terms of sustainability, I think it's important to mention that there are different types of sustainability. There are efforts that you can do to sustain the partnership with your stakeholders, so that you can continue doing projects in the future. There's also sustainability related to organizational infrastructure of a given community organization, or sustainability and capacity building go hand in hand. For instance, if working with a community nonprofit that seeks to continue taking part in health research but does not have an adequate system for client data collection, you may be able to provide guidance on developing a systematic approach to data collection, or maybe even help them identify someone within your institution that could provide this type of support. And then finally, there is sustainability in regards to how the data will be used. How will the research findings be used? How will they inform or be translated into practice, policy, services? All these are important considerations to build in at the beginning when developing your study plan. Okay, briefly, we're going to give here an example. I just want to see how we're doing with time. Okay, so have a few more minutes. Briefly here, we're going to give an example of an investigator. I don't know if she's on the call or not, but Christy Graves. She is someone who has really invested a lot of her time and effort to building her research portfolio around community engaged research, which is, you know, as I mentioned, it does take time, it does take effort, and so you've got to really reflect and say to yourself, you know, do I have that time? Am I willing to make that effort for my research? Or maybe even can I include research team members that can play that role? You know, not all investigators may be in a position to engage participants or communities, but you can bring in research partners that are maybe have more capacity to do that. So this is one investigator who's really made a concerted effort in this regard. And she's been successful with this particular organization, Nueva Vida, that helps Latinas with cancer or at risk for cancer. And this organization helps provide needed social support and access to cancer care, cancer prevention services. And this organization understood that there was limited research out there about social support for Latinas and how to design interventions around that. So they've contributed to research, and they continue to contribute. And Christy has built a great relationship with them. She's transparent. She lets them know what her goals are, but at the same time, she's willing to listen, and she comes in with what we call, humility, with an openness. She knew staff of the organization from previous events and activities. This is where attending events, joining coalitions or advisory teams at the community level is a good step to begin building those relationships. She was willing to do community presentations. In this picture, Christy and Claudia from Nueva Vida are actually doing a presentation about study findings. And they've incorporated some educational information as well. And one thing that she really did very well is ensure that the budget reflected the time and effort that the organization was putting towards supporting in recruitment and supporting in designing and helping to develop the study. She made sure that she asked the organization, what are your budget needs? This is what we need on our end at the academic institution. This is what's available. Let us know what you need. And I think that that's really key here, is that you want to ask what their budget needs are and not assume what those budget needs would be. Okay, so community engagement is not for everybody. It's challenging, it's time-consuming, it requires compromise. It's not always understood or developed or supported by university leadership. It is a balance between research and action, and again, that can be, very intensive in terms of time, and can create challenge in terms of the research process. But with negotiation and flexibility, those things can typically be worked out. And it's not just about research or grants and papers or recruitment. It's about relationship building and building that trust with your partners. Thank you. I am going to pass the baton over to Finney Richardson, who will talk a bit more about patient engagement.
Good afternoon. So as Florencia, she's done an excellent job, I believe, in defining and outlining some of the principles as well as key differences of community engagement and patient engagement. And so I would like to highlight some of the various ways to meaningfully engage patients, discuss some best practices, and address barriers. Now, the most common ways to engage patients and incorporate the patient voice in your research are through completion of surveys, patient participation in focus groups, and also informed interviews. But a more active form of engagement will also include patient participation on study boards or advisory boards with their peers and researchers. And so, for example, in the picture that you're viewing, this was taken at one of the GHUCCTS Volunteer Participant Advisory Board meetings. And just so that you know, all of the processes that Dr. Melman and Florencia previously referred to as part of community-based participatory research, those approaches were also utilized when establishing this patient advisory board. And this board, it was created to represent and include the patient's volunteer ideas and goals in the planning, the recruitment, implementation, evaluation, and dissemination of clinical research studies of the GHUCCTS. And so the board, once they were convened, they came up with the name of their group, the name of the board. They helped to develop their own mission and vision statements. So there's a sense of ownership from the very beginning. And I must say that kickoff meeting that we had with the board, we had our leadership there to truly show that they had a vested interest in the well-being and the creation and establishment of the board. So we had all hands on deck. And so that you know, the mission of the board is to advance the equity, safety, and excellence in scientific research through outreach to a multicultural community and the inclusion of the volunteer participants' voice. So moving on to some patient engagement best practices. The best practices are likely to continue to evolve as more research in this area and on this subject is completed. But first and foremost, it is paramount to establish trust and definitely foster mutual respect. And again, I think the most concrete example would be doing what you say you're going to do, keeping your word, being genuine, and being sincere. One, about the passion, why it is that you're doing the research that you're doing, and how it not only benefits you as the investigator, but more so, how does your research findings, how will it translate into improving the community and being beneficial for the patients or participants as they engage in your role, in your work. Also, it's important to ensure privacy and confidentiality of information. If your research involves collecting surveys or utilizing the electronic medical record to review patient health information, just ensuring that only those individuals who have a necessary purpose to review that information has access to it. And then as an investigator, how will you carefully store that information to ensure, HIPAA compliance? And even in terms of the laptops that you're collecting that information on, being able to say that that laptop is encrypted and there's an extra layer of protection, that all of your documents will be stored in a secure cabinet and a locked door. These are all things that we hear, and it's inquired and impressed upon by our institutional review boards, but patients and participants want to know that as well. It's equally important. I think it's also important to be flexible. Not all meetings and not all events are going to occur within the 9 to 5 workday, and you have to be reasonable of the ask of your study participants because it will be at certain times an inconvenience for them. And so it will be important to have some flexibility. Maybe you'll have to do some events in the evening after the workday or even on the weekend. Sometimes recruitment in certain community spaces and places, you're going where your participants live, work, and play. And that isn't always neatly done, within the confines of a research setting. So just be flexible and willing to go and meet the needs of the community where they are, your participants. It's also important to develop clear expectations that are explicitly described. You have participants that are completing a survey. It explicitly say how long will it take for them to complete the form, how many study visits will they have to complete after intake or for follow-up. Just be clear in what's required because that's actually respecting the patient's time and effort involved. It's important to also select the representatives of your patient population that you are studying. If your study is truly targeting, we can say, young women that are maybe located in medically underserved areas, then that will require you to engage with that population. Oftentimes it is easier to have the maybe lower hanging fruit and recruit from a convenience sample that's available to you, but you just want to make sure that you don't take any shortcuts. And I'll talk a little bit more about that and we talk about the barriers. It's also important to provide the appropriate training. If you are going to ask, for example, members of our advisory board to give investigators feedback on their research strategies and talk about the feasibility of the research, if they're going to review proposals for layman's terms, we had to be sure that we not only had all of these tasks and demands of our advisory board participants, but that we also sewed into them. So we give research 101 lessons for them. We do the fundamentals so that they can understand the research process, and then we ask them what were some additional topics that they were interested in that we may not have addressed. So just making sure that your patient partner has the expertise and the training along with their lived experience to be able to meet the needs and expectations that you may have for them. Give back to your participants, and we honestly cannot stress that enough. As I said, giving them training is one way, but making sure that you incentivize and compensate appropriately for their contribution. It's also important to think of ways to collaborate outside of just doing the work of research. So again, another example with our advisory board, we meet monthly, and we pretty much have a full agenda each month. We take a break for the holidays during November and December, but this past year, the board said, you know what, we want to have a potluck. We know we don't come together in November, but it showed that we have developed a sense of trust, a bond. They're like a family unit, and they look forward to coming, together and spending that time together. We make sure that we provide compensation for them for each meeting that they attend. And finally, foster equality by ensuring that compensation rates for our patients and researchers are comparable. I believe later in the presentation, we'll talk a bit more about budgeting and what that looks like, but make sure that you allocate adequate funding for your patients and not determine one's contribution or value based on their titles, but recognizing the value of patients for their lived experience, and they do have information to contribute in a meaningful way. Now, it's important to note that some patients, regardless of what approach you take, they may not be interested in engaging in research anyway. And so, despite some of the advantages in patient engagement, we recognize that there are also challenges. And so, it's important to think about these challenges that you may encounter in your project. However, with appropriate planning and early engagement, patient engagement is definitely achievable. Just wanted to highlight, although you may be working with limited funding and limited time, that it's important to address areas of recruitment and communication appropriately. The best way to do this is to make sure that you use plain language and address issues regarding health literacy. Florencia talked earlier about translating your materials into multiple languages. Just also being careful about the use of technology and social media. And I would say at the end of the day, the best way to recruit patients and keep them motivated, even though you may provide some form of compensation, really most participants engage in research because they want to help others. They want to help their family members avoid some of the complications that they've had as a result of their health conditions. And so it's important to make sure that you address motivation and that their participation in your research is beneficial. Due to time, I'm going to move forward quickly. I wanted to share with you a case study around patient engagement.
The way I got involved in the GHUCCTS advisory board is I participate in contribute. Research is important to me because it's an advocate for knowledge and trying to find answers to
We're working on it.
We're working on it.
Sometimes when you read a research protocol, a research flyer, I think to myself, why did they do it this way, and why not that way? And when you have the researchers in the same room answering those questions, you start to understand their thought processes. Nobody knows the patients like the patients know themselves. So if they're not part of that process, it would not benefit them or our community in the long run. That's why it's important for patients to be involved. At the end of the day, in my opinion, research is for the community. It should also be by the community, and that's why it's so important to have patients in the room and around the table when it comes to developing research protocols, whether it's how do we recruit patients, what are patients willing to invest in terms of, I guess you can say, blood, sweat, and tears to actually find answers to, to their diseases. So it's really about the patient, it's about the individual, and it's about the community. So that's why patients should really be involved.
All right, and we'll be sure to send that video link out later. Sorry, we had some technical difficulties. Now we're going to move forward. Based on your research focus, do you see yourself doing more CE or PE, community engagement or patient engagement? Please put your answer in the chat box. Thank you.
Thank you for providing your feedback in the chat box. We'll take note of that, and hopefully you'll stick around for the Q&A once we're done with the presentation. We have a few more minutes, and Yejude will be talking a bit more about how to integrate the principles, or how to integrate your partnerships within the context of putting together a proposal.
All right, so a phrase you want to keep in mind when we think about how to frame these partnerships throughout the grant application is a mutually beneficial exchange. Both Florencia and Finney either said or alluded to this idea in portions of their talk. But as we said throughout the talk, these efforts towards patient and community engagement only serve to enhance your research efforts and better benefit the population and communities you're targeting. Now, we want to talk about how do we communicate that effectively in grant applications, specifically the pilot grant. So a few things to keep in mind and take into consideration. We don't expect you to be at the gold standard. Everything that we shared, the combination of it all as it applies to your project would, in totality, bring you to the gold standard. It's an option, but we don't expect you, for example, in a clinical setting, to have the patient population participate directly in the formation of the aims, though that would be great. And through a quick plug I'm going to put in here, that could be facilitated through our participant advisory board. So feel free to reach out if you would like to. But we want to know what relationship you have with your partner and how it will develop over the course of the project. How are you meaningfully going to engage the community and the population? So some of the things we consider, as you can see here, the context as it applies to your research. Some immediate outcomes we're looking for are a connection, some language towards capacity building and relationship formation, as well as evidence of a continued relationship after the duration of the project. So here I want to touch on some of the review criteria we take into consideration when pilot applications are reviewed. These are variants of the traditional NIH review criteria assessed from a community and patient engagement lens. As you can see, all of these points are asking you to put into practice much of what we've highlighted throughout our talk. So just to point out a few, I won't speak to them all. This is something that will be provided as a resource to you after the webinar. But within the overall clinical and translational impact, we're looking for a measurable impact on an identifiable community group. Looking at significance, we're looking at something that addresses an issue of importance or value to the community or patient population you are targeting. And under innovation, how are the community partners or the patients engaged in addition to the nature of the research? Just as a reminder, we're not expecting to see all of these areas touched on in your application. We're looking for evidence that these criteria were considered and some combination of their elements as it applies to your research were included. So these are some additional areas of criteria that we are looking at. So for investigators, team members have training or experience in the community and patient-engaged research. That is something that can be facilitated through a lot of the resources that we have available, if that's not something that's already present, or just looking to the community partner or the patient population you're working with and seeing what is present and making sure to frame that clearly in your application. So quoted here are some examples of, we've pulled directly from reviewers speaking to ineffective framing and consideration of the community and patient partnerships. Highlighting here, we have the first quote here, that it doesn't sufficiently address how the application will improve quality of life. The one to the right, how are these communities going to be engaged throughout the entire project? And a consideration that I think Finney touched on before, African-American, reaching African-American women who do not have access to the internet. These are direct quotes that we received from reviewers after reviewing grant applications in our last pilot cycle. So what we are looking for is evidence of discussion or references that prior to this application, there have been steps taken to initiate and develop partnerships. That there has been communication about the way the partner will be woven into the project in a way that is beyond in name only or tokenism. Evidence of having gained entry into the community or with the partner, and that there is a development of a sustained collaboration. Or to demonstrate the sustainability of the relationship, how will you maintain the relationship, speaking to that directly after the cycle of the pilot project? Consider how your results will be disseminated and highlight ways that your partner can be involved. Sell to us in your application your realized value of your partner to your project. So I'm going to jump into some examples very quickly as we are getting towards the end of our time. We want to make sure we respect everyone's time. So let's take a look at some of the examples from past pilot project narratives. This first study was looking at absenteeism and asthma in public schools. And these quotes were pulled from throughout their narrative directly, highlighting that the partner would assist with school recruitment, providing educational materials on air quality and asthma, and assist with disseminating results. Also highlighting that they recruited nurses from the individual schools, and the nurses were given a 2-hour training by the investigator who was conducting the study, and they also participated in some of the decision-making as it pertained to what was going to happen with the data, as well as designing data collection materials. So in this study directly, they involved their partner and involved the school nurses to collect the information that they needed, as well as create some of the measures that they were using for this study. Going into our second example, application B, we had a consultation that was conducted by one of our many resources here, working with Ms. Florencia Gonzalez, who presented on a number of areas in our talk. And in this consultation, we had an investigator that had submitted an application, and we found that from the reviewer comments that they had not really effectively and to their benefit framed what was a really great partnership. So based on those recommendations and speaking with various members of our team, they went ahead and highlighted a few members of their team who had extensive experience in community-based participatory research. And we asked them to provide an updated biosketch that clearly highlighted what that experience was. And then they also, working with that team, were able to build a conceptual framework that highlighted the fact that they understood that there were strengths and resources within their community and how best they were planning on utilizing those things. So within the budget, this is another area of importance and great ground with which to highlight your partnership with your, partnership and relationship. In here, we're looking for budgeting for the community's compensation in an effort as key personnel. As you see here, we have an example of a pilot studies budget that was submitted in which they had staff from the partner listed as key personnel in the budget, and they were provided, salary coverage was provided. We're also looking at consultants. They can be included as consultants, subcontracting a portion of the funds to the partner directly for whatever portions of the study they will be conducting. And then we're also looking for them to be named specifically, so specific members of your partner. If you have identified a particular person, not just stating we are going to work with entity, but we're going to work with so-and-so within entity, and stating what you realize they're going to be bringing to the project and what they're going to be doing specifically on the project, so that we have clarity that this, again, is not in name only, but they are fully integrated into your project. All right, so I want to thank everybody for participating and holding on as we went a little bit over with the information giving portion of the webinar. Listed here, you have the information of everyone who participated in the presentation, as well as our contact info, so you can feel free to reach out to us. Now we're going to shift into the Q&A portion.
When you had those salary portions in your partnership and budget section, are they paid? I mean, the budget's going to come to your organization. Then do you pay the community for those salaries? Do they go directly to the individual, or do they go to the community organization, I should say?
So is your question when you're putting the budget together? Do you?
No, when you're doing it, when you're implementing it.
Repeat the question again. I'm sorry.
I'm just curious how they're paid, because let's say you're successful in getting those funds, or
okay,
to pay community members. The funding is going to come to your organization, and then do you pay the community that portion to pay for that person?
So when, let's say, for example, using our pilot funding program as an example, I'm sorry, this is Yejide speaking to this. When you are awarded a pilot grant and you have a community partner, one of the things I highlighted, for example, was having them in the study budget as personnel. And let's say they are personnel in the budget or they're a consultant. Our mechanism is to provide a subcontract to the community partner. So to have them set up as a vendor, and they will receive a contract from us, and they'll be able to invoice us for those things that are listed on the budget.
That's kind of what I thought. I see other questions, so I'll mute off here.
Thank you for your question. Very, very helpful. Do we have other questions? Can you read that off? Or what's the person's name on that?
Sure. We have a question coming in through our chat from Candice Vanderstelt. Please excuse me if I didn't pronounce that correctly. It was, do you have any tips or resources for researchers starting a patient work group?
Candice, are you on the line?
Yes, I'm here.
Oh, great. You want to elaborate a bit more?
Yeah, so I'm at Georgetown in a lab that looks at stroke survivors, and we are looking at starting a group that's not just focused towards research, but certainly has a component of like monitoring and evaluation of our research, and just seeing how we can make the research more accessible to them. And I'm looking at starting a group, and the biggest barrier for me is just knowing how to get started. I do have one stroke survivor who is willing to be kind of partner with me in that, but that's as far as we've gotten. And so I'm just wondering if you guys have, tips for starting that discussion, or you know, any resources of even just questions to ask them or topics of conversation to bring up.
When you say them, what kind of setting are you in? Like, what access do you have to patients or to communities right now?
So I'm in a research setting, and I think what we would be doing is looking at, we have some participants who participate in multiple studies over the course of several years, and so I'd be probably looking to pull a small group together from those that we have relationships with.
Mm-hmm.
Well, that's exactly the great start that you can have, just letting them know that you appreciate their participation in the past and you're looking to expand their role to see how they could contribute in a meaningful way as a part of an advisory board. And what we did was we, provided an overview, a sense of what they would be doing. It was very clear. And then we did a brief survey about other health topics that they were interested in, what's their best availability in terms of their ability to meet and the frequency. And we basically set a date. We reached out, we got their contact information, and we went from there. Mm-hmm. That first meeting, it was really getting to know and providing a sense of what would be the scope for this group.
Okay.
And how could they best contribute. So we will be able to send to you a guide that we use to convene and establish our advisory board. I think it would be very helpful.
That would be incredible. Thank you.
And we also have templates and probably standing operating procedures that came as a result of the process.
Okay. Yeah, that would be excellent. I can leave
Thank you for
email here in the chat.
Perfect. We had a question in the chat earlier that's wondering about the use of patient versus participant language. Why use patient? The person who asked this, are you still on the line? I'm wondering. Sometimes we use terms interchangeably. I'm not sure what the background of the question is, but it could be that we're just using the words interchangeably. Though patient engagement or patient-centered research is very much commonly used by funders such as PCORI. PCORI it funds patient-centered research, and I think that's one of the reasons more and more investigators are sort of steering towards engaging communities, engaging patients in their research. And I think I personally use patient because it's what's typically used by such a large funding mechanism as PCORI, and I try to be consistent with that approach because they really are sort of spearheading the whole patient-centered movement. Hope that answers your question. So we have someone that wants to share additional feedback. You can hold on 1 second. We're going to unmute the line and have him share his thoughts.
Where should I speak to?
Right here.
Okay, this is Dr. Millman. I just wanted to share the thought that often research does involve recruiting patients, in other words, directly from a clinic or a hospital setting, in which case I think the term is accurate and appropriate. But other times we might be recruiting from community settings, neighborhood recruitment or whatever, in which case the person's not necessarily a patient, and then I would be careful to use the term participant.
Thank you, Dr. Melman. So do we have any other questions? So can you give examples of how a researcher can give back to the cohort community? From Ella. Ella, are you on the line?
Yes, I am.
Okay, great. Can you expand a little bit more?
Sure. I'm at Georgetown and I study people born blind or without hands. And I'm trying to reestablish the connection with my patient population. I just started here. And I want to reach out to organization of low vision people around, but I mostly don't know what I can offer them apart from asking for their participation in my research. So that was the main question. What kind of support can I offer?
Right, and sometimes, just asking them what they need, and then seeing if they, if you were within your institution, if not you directly, but maybe through the networking through your institution, you may be able to find resources. You're not going to be able to meet every request, for sure, but as long as you make an effort to look for ways to support them. I know in our experience, having an expert come out and talk, let's say an oncologist, taking the time to go and talk about breast cancer prevention during Breast Cancer Awareness Month was a huge success for one of our church partners. And that particular investigator built a really good rapport with the church community and the health minister. And right there, she had her doors open to a potential partnership. So, and these are things that we can explore in individual consultations to see what other resources you might have available that you're not aware of right now.
Okay, thank you.
Just speaking to that as well, we have another investigator here whose focus is on Alzheimer's research and has been able to really build almost a family and community feel into the participants, and they have been participating in studies with him for a number of years over the course of various studies, rolling from one study to another, depending on how able they were to. And one of the ways that the team has been able to maintain and kind of give back is to provide space for community to happen. And one small way is having a holiday party every year in which they provide food and bring everyone together and just do something that has all these participants that are participating in the research. They're doing something that's separate from the research that isn't necessarily directly related to it, but it's still making them feel like they have some buy-in into what's going on in the overall system.
That's a great idea. Thank you.
So Ella, please follow up with us. Our resource, our contact information is on the screen, and we'll also be following up with an email with our contact information. And we would, we look forward to anybody on the line, anyone in this presentation, or that was a participant in this presentation, to follow up with us. We're eager and very happy to work with you and explore ways that you can enhance your research plan in bringing in the patients or communities, and also your grant proposal and budget.
Great. Thank you.
Any other questions? So we do have, in terms of our, and I'm going to just go back to the slides that we wanted to present a little earlier, but we ran out of time. But I'll present them now. Is that we do have an array of services through GHUCCTS. In GHUCCTS, as Dr. Melman mentioned, we have investigators at MedStar, Howard, Georgetown, the VA, and we have experts in these fields, in the field of patient and community engagement, and we can be of great support. But not only that, we have we're able to support you also with, for instance, management and analytics support, biostatistics, and bioinformatics. We're here to support you throughout the research process, whether it's putting the protocol together or putting a grant together, coming up with recruitment plan, dissemination. We also can connect you with the Community Advisory Board or our Patient Advisory Board. We have networking opportunities to connect you with community organizations. We don't guarantee always that there will be an organization that we can identify that fits the research focus, but we can at least explore our network and see if there are any of our partners that could fit. We also attend community events to raise awareness on clinical trials, and we do bring information about the different studies that seek our services. We share study flyers at those events. And through our consultation services, we can provide resources for building sustainable partnerships. Okay. So we're here to support you. Anything else? Okay. Any other questions, thoughts, or comments? And we apologize if we weren't able to get to all the questions. We had a little hiccup with the chat earlier, and but now we're back on track.
And feel free, if you think of a question after the duration of the webinar and this Q&A portion, feel free to send us an email at any point, whether it's today or 2 weeks from now or a month from now, just asking about anything that we've shared for greater clarity, for linking to our resources. And for anyone who is interested in or planning on applying to the pilot grant program, those applications usually go out around March or April. But prior to that, we'd really love for you to engage in these resources that we have available so they can you can get the benefit of having them inform your application. So if you have any questions about that specifically, please feel free to email me. And I'm just going to go ahead and move us to that last contact slide. So if you need to, you can go ahead. Oh, I think I might have actually gone way beyond that. You will get an email with our contact information, so you can feel free to reach out to whoever it is that would be pertinent for any of your requests. If there are no more questions coming through the chat or over the phone, I think we're going to go ahead and close up shop here.
We'll leave the presentation slide up with the contact information until 1:30, but we'll end our conversation here.
Thank you so much, everyone, for your participation and your engagement, and we look forward to continued discussion with some of you offline.
Thank you.